A common struggle students have when starting their academic careers in the health sciences is adjusting to the rigors of school and the raised expectations compared to their undergraduate experiences. The study skills that were effective in getting them to the next level of their education suddenly no longer work. Many, used to receiving straight A's, suddenly find themselves struggling to find the right path to success. Some adapt and thrive, but others aren't able to adjust and have to drop out. In order to help understand students' perceptions of what it takes to succeed and how those perceptions change once in school, Dr. Melissa Taylor and Dr. Sharon Valente, both of the University of Tennessee Health Science Center, recently presented a poster at the annual conference of American Association for Anatomy titled Understanding Student Beliefs About Learning Anatomy in a First-Year Medical Gross Anatomy Class, a Pilot Study. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teach Well Learning Center. Each month, we interview members of our faculty and staff about their research and its impact on the higher education community. Join us as we discuss the results of their survey asking first-year students about how effective they perceive various learning strategies are to their success and how those perceptions change over time. Joining us today is Melissa Taylor. She's an associate professor in the College of Medicine at the University of Tennessee Health Science Center. Melissa, welcome.
Thank you so much for having me.
We are also joined by Dr. Sharon Valente, Director of Institutional Effectiveness here at the UT Health Science Center. And Sharon, welcome to you.
Thank you for this opportunity. Appreciate it.
I'm looking forward to this conversation. Melissa, can you start us out? Can you just briefly summarize your paper and why this topic is important to you?
Yes, so we wanted to look at student beliefs about learning anatomy in a first-year medical gross anatomy course. And learning anatomy is a very hard task in general, especially in medical school. And so there's a lot of information thrown at the students really, really quickly. And also anatomy serves as the foundation of a lot of their medical school courses that they will be taking. It's kind of like learning a new language. And so it's really important for us to understand how the student beliefs are changing or being impacted by their educational experiences. And so what we did was we utilized this survey called CLASS, which is the Colorado Learning Attitudes About Science survey. And so we adapted that survey to be more anatomy and medical specific. And we wanted to look at student attitudes about learning anatomy in medical school with the eventual task of helping faculty design an effective curriculum. And so we distributed this survey before they ever took medical school anatomy, during mid-semester, and also end of semester to see how their perceptions have changed about anatomy and learning medical problems. And so it's really just important to understand how students are perceiving their anatomy and their anatomy education, what is working for them, how they are thinking about their learning, and how we can utilize that information towards designing an effective curriculum.
My only experiences with anatomy was as an undergraduate myself. And I remember the book was written by two authors. The authors were Torturus and Agnosticus. And I remember that because the professor said, this semester is going to be torture and agony. And so even as an undergraduate, I remember how hard that course was. My daughter just took anatomy last semester at University of Memphis, and I was working with her. And I said to her, be glad that you're not in medical school because this is going to be nothing compared with what you would have to do in medical school. So talk a little bit about the differences between learning anatomy as an undergraduate and as a medical student.
Sure. So very often in undergraduate anatomy, it's typically a prerequisite to get into medical school, to get into physical therapy school, or at least it's encouraged for the students to take an anatomy course. Typically, I would say from my experience, students don't just on a whim sign up for anatomy if they're a business major. So it's something that they have to take typically. And so typically an undergraduate anatomy course may be integrated with physiology, but it could also be a standalone course. And then, at least in our medical school, anatomy is integrated with cell biology, embryology, and ultrasound, in addition to the students also taking a molecular biology course during the same semester. And then that information serves as a foundation for their organ systems courses later on in their education. And so, from an undergraduate perspective, anatomy is not as robust as it is in medical school. And it really does vary medical school to medical school, but typically in our medical school, it's a very robust course, and the students take a dissection course as well, which is not always the case in an undergraduate anatomy course.
I was surprised that more than half your respondents hadn't even taken an anatomy class before coming here. Does that put them at a disadvantage over those who have had it?
So what we have seen and what literature has shown as well is that it does not put them at a disadvantage by the end of the semester. And so the American Association of Medical Colleges, the AAMC, does not have anatomy as a prerequisite, even though at some undergraduate institutions it is a prereq to get into a pre-med type of program. But it's not required to enter into medical school. And so what we've seen and what the literature have shown is that in the beginning of the anatomy course, students may be at a slight advantage if they've had anatomy before, just because they might be a little bit more familiar with the terminology and some of the initial things that will be discussed. But typically, students in an undergraduate course haven't gone through a full dissection course, and that can vary undergrad institution to undergrad institution, but typically that's not the case. In medical school, where there's typically a dissection component, students who have taken anatomy before may have a slight advantage at the beginning with already having an understanding of the basic terminology. But typically what we've seen by about halfway through the course and at the end of the course is that students who've not had anatomy have been able to, quote unquote, catch up to the other students. One of the major issues for all students, whether or not they've taken anatomy before or not, is finding out the correct way to study the information, which may have worked for them in their undergraduate institution, but could be something different that's not worked for them in their medical education.
To document what Melissa has said, we actually ran statistical tests comparing the results for those students who'd had anatomy and those students who had not had anatomy on the data from pre-starting classes, midway through the semester, and the end of the semester. And with less than 3 exceptions on all that data, there was no statistical difference. Which proves that there was no significant advantage or disadvantage for having anatomy.
That's really interesting. I would think that the students that had anatomy would have an advantage, especially since you're digging so much deeper into material than what you get at the undergraduate level.
Exactly. We were surprised by the results as well.
Your poster has a really beautiful table about the different learning strategies and asked your respondents to rank those. Can you talk about those different learning strategies that you described and how students reported how helpful they were or they weren't?
Sure. So I'll go over a couple examples of those learning strategies. One of the major ones is called Anki cards, and this is an online slide index either created by the students themselves or by other students to study medical information. And those Anki cards allow for repeated exposure and spaced repetition of the material. And so anecdotally, I know a lot of students have found these cards really helpful. Whether or not they're necessarily encouraged by the faculty, I know there's many different opinions from faculty about these types of cards, but students themselves have found them very helpful. So that's one of the tools utilized by students. Another one is formative practice questions. And the faculty in the medical school have really outdone themselves lately with providing practice questions to the students. And so these are ones that don't count for any points. We often provide them at the end of a lecture. We provide them before they have their exams, and then students sometimes also go searching for practice questions as well. And then tutoring, that is done through the Office of Student Success, and it's where upperclassmen come and tutor students in anatomy. There are upperclassmen that are coming into the labs on the weekends and opening the labs for students to learn from them. And they do a lot of really great drawings in lab, and so the students are really appreciative of that. And then we also encourage drawing. We do some of it in the classroom, and we encourage students to draw as well. And then for 3D software, we have the College of Medicine has a license for a 3D program called Complete Anatomy. And so we encourage the students to utilize that. And so in the beginning of the survey, before students ever had exposure to the medical anatomy course, we asked them, how do you think that these different learning resources will be helpful for your understanding of anatomy? And so one of the more interesting things was that tutoring, something that has been highly ranked by the students on their end-of-year course evaluations, was ranked lower in the survey. And that could just be because maybe they've had tutoring in their undergraduate institutions, and maybe it wasn't as robust as the tutoring that we provide for them, or some other reason. We don't really know. But that was really interesting. And for formative practice questions, the students actually might not have known what that word is, formative. We teach that on day one, and we will tell them that we will provide a ton of formative assessment questions. We actually don't use the term practice. We use formative assessment questions. So they might not have been familiar with that term, which is why it might have been ranked a little bit lower than some of the other components.
To follow up on Melissa's observations about tutoring from the initial survey before they've started classes, while it's not, the results were not significant, there's definitely an increase in the appreciation and the ranking of tutoring by the end of the semester. I think Melissa pointed out, undergraduate, it may have been a different experience. Tutoring here at the University of Tennessee Health Science Center focuses very specifically on the subject and the rigor of anatomy and the importance of anatomy throughout the medical curriculum.
I'm glad you clarified that, because I was surprised when I was looking at this. I didn't know that this was at the beginning of the class.
Yeah.
And so they haven't experienced any of these things yet. And so saying that students didn't know what practice questions were, so the tutoring is based on maybe bad experiences in undergraduate, I think is really interesting, because we talked with some faculty a few months ago about the use of practice questions in medical education, and they kept on talking about how students wanted more and more and more practice questions, and there were never enough. So do you have data that shows the difference between what they feel about these learning strategies at the beginning of the semester versus at the end of the semester?
We do. We're in the middle of analysis right now of comparing the results from the August 2024 survey results to the October survey results to the December survey results. And right now, to be honest, the only one I can remember is the tutoring, because as you've noted, the initial results, tutoring was not ranked highly. That changes by the end of the semester. Now, what I want to do is get in there and see if that result is significant. Was it significant by October? Was it significant by December? Because that would go to the heart, the purpose of this research. How do we support students being successful?
I bet you that it's different after the first exam, because I'm sure it's eye-awakening for many of them. I think that I just saw a video of for new medical students, and Mark Miller was talking about how this is going to be different than undergraduate, and the things that worked as an undergraduate aren't going to work as a graduate or as a professional student anymore. And so I'm sure it's very eye-awakening when they get that first exam score. Probably not many of them have never gotten anything lower than an A on a class.
Yes, that is correct. And that's usually why, as faculty, We try and have one-on-one meetings with students who feel they're not performing up to par after their first assessment. Often we'll sit them down in our office and go over learning strategies that they can utilize because, as you said, it is incredibly common for them to have scored all A's, a perfect 4.0 in college, but then once they get to medical school, it hits them all at once that they are competing against every student who got A's in all of their courses, and so they need to find better ways that work for them to understand the information.
So we talked a little bit about how students perceive this. Was there anything else that surprised you about these learning strategies and how students rank them?
If you look at the survey, the results that stood out to me was I don't want to say significance, but the strong response to memorization techniques, to surface learning orientation, what we commonly refer to in higher education as the picture model, the lecture model. The professor will pour it into me and I will take it in. That is not medical school. That is not anatomy. And that mindset is one of the challenges. I wouldn't be surprised if that was underlying the presentation you saw from Mark Miller, that we need to address as soon as possible so those students will be successful.
One of your survey questions asked about whether reading text in detail is a good way to learn. As someone who's in teaching and learning center, we've talked about this with faculty for a long time, but even then, most of your students felt like it wasn't a good way to learn. How does that affect how anatomy should be taught?
So I'll go back to my undergraduate career a little bit, where we had assigned readings from textbooks, and the teachers typically would encourage us to read the text before coming to class. And then they said it was a very great way to study. Well, then years pass, and then a lot more educational research comes out, and a lot of it's about more active learning, which is a lot of the important research coming out even currently. And so what we as faculty do is, yes, we are reading from our notes and from our PowerPoint slides typically in the lecture, but we try and integrate active learning into the classroom, whether that might be doing some drawings, either physical drawings, or I've seen faculty do drawings on their iPads in the classroom, formative assessment questions, even something like coming into lab and asking this anatomy lab and asking the students questions during that time to try and integrate the information as a form of active learning. And so that's something that we are encouraging the faculty to do and also encouraging the students to do. I can't tell you how many times a student has come to my office and I ask them, what are your study strategies? And they say, oh, I just rewrite my notes, everything from lecture. And so you have to kind of steer them away from that and tell them, no, that is taking up way too much of your time. Let's look at your notes. And then let's try and put those notes into chunks, into flowcharts, into tables, into a drawing. And that is a much better use of your time to try and understand the information.
In the world in which I operate, assessment and accreditation, the parallel to active learning is called authentic assessment. That's where the simulations and realistic hands-on work becomes critical to teaching, to learning. The good news there is it's successful if the students have done the prerequisite, if you will, reading. Less successful if they have not done the reading. The bad news about that is it's so exciting when it's authentic, when it's realistic, that sometimes we, the students, miss the connection and the importance of having the base of reading, of having that basic understanding before they get to the realistic simulation.
There's another question in your poster suggesting that students can relate important information to what they already know. How's that? I'm back to the question about prior experience and taking anatomy in the past. How's that square with students who haven't had anatomy?
So we haven't found any significant difference in that question between students who've taken anatomy before and students who've not taken anatomy before. And really, anatomy and learning medicine and medical information in general is all about understanding relationships. So a lot of the students will come into medical school with some prior experience in the medical world, whether it be a previous job in medicine, whether it be just shadowing or volunteering at a hospital. And so they all have some sort of connection to medicine already. And that is why they're in medicine, because something in their life interested them. And so I always see students, as I'm teaching them, or maybe not understanding, but relating their prior experiences to what we are teaching them. Often I'll teach about a subject in the classroom, and a student will come up to me after class and talk about their experience with it. If I'm talking about some sort of procedure that I myself have never performed because I am a researcher and a PhD, so I'm not a clinician, but maybe they've had experience as an EMT. And so they can bring that experience to what we're talking about and what they're learning in the classroom. And so we like to emphasize how learning anatomy, you're not just learning the different parts, you're learning anatomy as a whole, and you want to understand anatomy as a whole, especially since this is a course that the students take before taking their organ systems courses later on in their education. And so we want to have them think about anatomy as a whole system so that they will gain a wide array of knowledge about the processes in the human body, and that they'll expand upon that in their future courses.
It's not only relating important information to what they know, it's going back to the discussion we had earlier about learning in medical school versus learning in undergrad. The key component that we keep coming back to is developing those critical thinking skills and developing them at a level that will allow them to be successful in their medical school studies. So the information itself is important to relate to, but pulling the critical thinking skills to be successful in anatomy and in medical school is very important.
In your poster, you also talk about looking for others to also participate in this survey that you've given, presumably at other schools. Why is that important, and are you still looking for folks?
Why is it important? Not only do we want to help faculty and students here at the University of Tennessee Health Science Center be successful, but one of the ways we can do that is by comparing the students' beliefs and expectations here to students' beliefs and expectations at other institutions. The researcher in me is just drooling because it will help us, it will help the other institution. Most importantly, it will help our students, and that's what it's all about to me.
I also think that if we're talking about research that needs to be generalizable about how do we teach anatomy, this whole idea of external validity, right? We have this a small group of students in Tennessee, but if we could compare students in California and other countries and other places, that just makes the conclusions that you've made here stronger.
Absolutely. I came to the University of Tennessee Health Science Center a little over 2 years ago from the College of Medicine at Florida International University in Miami, and I see the differences, and it's not a positive negative. I see things we do here, for example, the way Melissa teaches anatomy to the way anatomy was taught at FIU. And one person can benefit another, one school can benefit another. The advantages of comparative research can help everybody.
I assume the answer is yes, you're still looking for others to participate. How do they get a hold of you?
Well, so from that conference, we had the QR code for people who are interested, and hopefully we may present similar information, more research at other conferences in the future, or just through networking. That's the conference I went to is the American Association for Anatomy, and it's a conference I go to every year and do a lot of networking there with other anatomists and other educational researchers.
In talking with colleagues here, colleagues who have moved on, colleagues from FIU. So networking to get those comparative people and colleges to administer the survey.
So based on this study, what changes are you thinking anatomy education needs?
I don't know that I would call it changes. How do we further supplement and implement strategies to help our students learn?
And succeed.
Yeah.
So what are the next steps?
The major next step is looking at analyzing the data, although I've crunched the numbers several times over. One of the things I'm very interested in, I also happen to be the resident keeper of data on tutoring. So I've pulled the tutoring data from fall for anatomy. I want to compare that, especially to the December survey results, to see if it's had an impact. Also, looking, as we mentioned earlier, comparing those who've had anatomy to those who haven't had anatomy. Is there anything interesting or of note that we need to plan for from beginning to mid-semester to end? Are there key inflection points that we need to be addressing? The other major step, I believe it's next week, we have orientation for the incoming class. I just finalized the survey and the QR code to get for that incoming class for their participation. The end result is using the data, as you noted, to help students succeed.
All right, very good. Well, thank you, Melissa, for your time.
Thank you.
Sharon, thank you for coming by today, and we really appreciate it.
Likewise. Thank you.
And that's this month's episode of Teach Well, Learn Well. Thank you to Dr. Melissa Taylor and Dr. Sharon Valente. I'm Tom Lochner of the Teaching and Learning Center at the University of Tennessee Health Science Center. Until next time.